Good afternoon, Sarah. Thank you for coming in and interviewing for the Children's Trauma Center's social worker position. You have a lot of jobs on your resume, a lot of impressive jobs. Which do you think was the most significant?
I would say the most significant job I've had was definitely working at the Department of Children and Families as both a treatment social worker and an investigation social worker.
Okay. What was your biggest challenge there? I know those positions aren't easy.
I would say probably the most difficult obstacle I was faced with was removing children. It was just very impactful on both the child and the family. Really, both the family and child were dealing with pretty significant trauma when that was happening. And kind of underneath that, there was just a lot of documentation and court involvement that happened with that.
That can be a pretty stressful job. Did you do anything to take care of yourself on your off time to make sure that you were able to maintain a good mental state?
Yeah, I think it's really important to have a good relationship with both your supervisor and your coworkers. At DCF, I definitely leaned on coworkers quite a bit. And really in a lot of my jobs, I think it's important to have a good network and team of people that are surrounding you when you are in that type of challenging position.
Did you approach any problems in your own way at this job? Did you tackle any difficult situations that you had to come up with on your own?
There were definitely a few situations where I feel like I had to kind of utilize what I've learned in past jobs, whether that was when I was working in foster care or working in group homes. It's really just taking different perspectives that I've gotten from working with those type of clients and trying to bring it into that field where I think just other social workers may have done it a little differently than me.
Do you think your time at DCF helped you transition into your role at the school that you've been at for the past 3 years?
Absolutely. That role has really, it changed me quite a bit in terms of everything that I learned, both working with children, youth, and families. And the clinical day school I'm at right now, I work with a similar population, a lot of children with mental health concerns. So we have to look at a lot of resources out in the community and work with different providers, which was something I had to do at DCF. So it's really a team approach.
Can you tell me about a time you had to deal with a difficult client, and how did you handle that situation?
So I think in social work, we often deal with difficult clients, weekly, if not daily. Definitely that was something that came up pretty frequently at DCF. I would say a situation that was really challenging for me was when I did have to go to the hospital to remove an infant. The way I was able to get through it is really just treating the parents with as much respect as they deserved, even though it was a really challenging situation. It's always trying to remember that the family is doing the absolute best they can in the moment, and my job is just to keep the child safe. So that was kind of how I was able to get through it, on top of using the support of my supervisor.
That's good. This being a children's trauma center, it seems that your time spent in the hospital on your last internship might segue pretty well into this position. Do you feel the same?
I do. I've definitely, there's a lot of different aspects from the hospital that I feel like I'll be able to incorporate in this job. The assessment piece is really important. I know that's important for you guys when we have intakes coming in and children coming in and working with families. And really working with a diverse population. I know, trauma is dealt with, all types of children and people, and that was definitely something I got to see both at the hospital and my other jobs. I think definitely everything that I learned at my hospital will definitely be really beneficial for me at this job.
What was your favorite part about working at the hospital?
I work with sickle cell patients and patients who had previously been diagnosed with cancer when they were children. I think just getting to meet so many different individuals, and I love to hear people's stories and stories of resilience. And I think working at a hospital has really given me a really good understanding of how resilience can keep people going. And that's a really important aspect to working with children with trauma, is they're very resilient. And, I hope that I'll be able to bring what I've learned and support children who are going through really, really difficult times in their life.
We're looking for somebody that can hang in for the long run. Where do you see yourself in 5 years?
So my passion has always been child welfare. So, I'm sure if you look at my resume, you can kind of see that, all of the jobs that I've picked surround child, youth, and families, and typically surround trauma, child abuse, and neglect, because I think that's just really important. So for me, this is really my dream job. This is what I've been working really hard through my master's program to get to. So my hope would be, if this is the job I get, that this is where I'll stay, and hopefully I'll be able to kind of work my way up if there's opportunity for growth in the program.
Do you feel that once you settle in, you would be ready for a managerial role in a managerial position?
I definitely would like to take the time to get to know the program and my clients, and learn as much as I can, but that is absolutely a place that I want to get to.
Good. Well, I think this went well. I would like to thank you for your time. Thank you for coming in, and we will be in touch.
Thanks so much.
Yep.